Let's talk about the techniques of breast reduction. The techniques of breast reduction are usually classified into the incision or the final scar, as well as the pedicle or the blood supply going to the nipple. So these are the two areas where techniques may differ between surgeon to surgeon. For example, if you only need a small reduction, you may end up with a scar around the nipple and down to the breast crease, but no incision across the breast crease. But in general, breast reductions will require removal of anything that's falling below the breast crease, and this will usually incur a scar around the nipple, down the breast, and across the breast crease in what is often known as an anchor scar. Now let's talk about the techniques relevant to the blood supply to the nipple. We will usually be elevating the nipple in a breast reduction or lifting the nipple up to a higher, more ideal position. Now to do that, you need to maintain blood supply to the nipple to keep it alive. And so you can either base this on tissue from above the nipple, below the nipple, on the inner aspect of the nipple, or a combination of the above. So they're the different techniques, and I think it doesn't really matter which technique a surgeon opts for, as long as the surgeon gets a good result at the end of the day. In terms of the different techniques of breast reduction, the recovery is usually very similar. There are risk factors and risk profiles with different techniques, and your surgeon should explain to you what they are. I think in different surgeons' hands, different techniques work better, and it all depends on the experience that the surgeon has had with various techniques and what works best in their hands. In terms of recovery for a breast reduction, I usually tell patients to have about 2 weeks off study or work, but some patients will return to work sooner than that depending on the type of work that they do.